In this video, we'll discuss the basic assessment and emergency care of patients with a left ventricular assist device. Following the completion of this video, you should be able to describe the purpose and indication for a patient to have a left ventricular assist device, demonstrate a patient assessment on a patient with an LVAD, identify the care needed for patients with an LVAD who are experiencing a medical emergency. A left ventricular assist device, often shortened to LVAD, is a mechanical pump implanted to the left side of the heart which aids in pumping blood throughout the body. A patient who is living with end-stage heart failure, in which other treatment methods have failed, would be considered for such a device. Typically, LVADs are used to help heart failure patients who are waiting for a transplant, or they can be used for long-term therapy, often referred to as destination therapy. In destination therapy, a particular patient is not a candidate for transplant at the time of their evaluation, but placing the LVAD will provide them with a better quality of life. When looking at the LVAD system, most of the medical device is implanted on the inside of the body. Visible on the outside of the body is a percutaneous driveline. The driveline connects the pump to the system controller. The system controller is located on the outside of the body and controls the pump. The patient usually carries this in a pocket on a vest, a neck strap, or belt attachment. The system controller contains the user interface, consisting of a screen, buttons, and lights. The screen can display system data, user instructions, and alarms. Alarms are also emitted as audible beeps, for example, when a battery becomes detached. When the LVAD is running, the pump running symbol is illuminated by a green light. 2 batteries are required to power the LVAD. Fully charged new batteries can power the system for up to 17 hours. A mobile power unit will most likely be powering the system when patients are indoors, sleeping, or stationary. Patients will have access to a spare controller and additional batteries. These will be in a travel bag the patient carries with them. You will need the following equipment for basic assessment of an LVAD patient: blood pressure cuff, Doppler ultrasound and ultrasound gel, stethoscope. In this video, a mask and gloves are utilized as personal protective equipment. You must protect yourself prior to responding to any emergency scene. Follow your organization's personal protective equipment protocols to reduce your risk of exposure. To begin your assessment, recognize that the pump will be operating continuously, so the patient will not have a pulse. Also, be aware that all LVAD patients are anticoagulated due to the risk of clot formation in the pump. When assessing the patient's vital signs, be sure to check for the following: auscultate for a hum over the patient's chest. The presence of a hum ensures the pump is running. LVAD patients will not have a blood pressure. Instead of a blood pressure measurement, it's necessary to utilize a Doppler to obtain a mean arterial pressure. You should be listening for a pulsating sound from the Doppler. The goal for the map is 70 to 90. Skin color should be pink, warm, and dry. Assess patient's orientation status to person, place, time, and situation.
Can you tell me your name?
Tom Calabro Jr.
Can you tell me where you're at?
I'm in Bellevue, Nebraska, and I'm having heart issues and I'm an LVAD patient.
Okay, can you tell me what year it is?
2022.
Thank you.
The patient's capillary refill should be less than 2 seconds. Check for signs of fluid overload. If the patient is fluid overloaded, you may notice swelling in the lower extremities. Following your patient's physical assessment, check the charge level of the LVAD's batteries to ensure the batteries in use are not depleted. Press the button with the battery symbol to view the approximate charge level of that battery. If the current batteries are depleted, attach fully charged replacement batteries. To attach a replacement battery, first remove the current battery by depressing the battery release button on the battery clip. Then remove the current battery. Align the red arrow on the replacement battery with the red arrow on the battery clip. Push the battery into the clip until you hear the battery click into place. Spare batteries can be found in the patient's travel bag. The last step is assessment of the percutaneous driveline. Check that it is not damaged and is free of infection. While interacting with the driveline, make sure that you do not pull on or move the driveline at the exit site, severely bend, kink, or twist the driveline. Position the system controller such that it will catch on the driveline. Be careful to ensure the dressing remains intact and the driveline cable is connected to the system controller. If the driveline cable has become detached from the system controller and it is appropriate to reconnect it, you can reattach by aligning the driveline cable connector alignment arrow with the system controller driveline connector alignment arrow. Then insert the connector. When fully inserted, you will hear a click. Lastly, rotate the safety lock on the back of the system controller into the locked position. LVAD patients are susceptible to complications, which can include hypovolemia, right heart failure, arrhythmias. Arrhythmias must be treated using ACLS guidelines. Cardioversion or defibrillation may be performed as needed. This will not affect the VAD function. Thromboembolism, infection, psychosocial issues, neurological dysfunction. If you encounter a patient whose LVAD pump has stopped, the goal is to get it restarted. The pump needs to be restarted within 10 minutes of stopping. If you are unsure how long the pump has been stopped or the time is over 10 minutes, do not restart the pump. Reasons for the pump stopping include depleted battery, loss of home power and not switched to battery, controller failure, driveline fracture, pump failure. Careful considerations should be made when determining when to begin compressions on an LVAD patient. If a patient is found unresponsive, with poor signs of perfusion, the responder should rapidly assess the function of the LVAD. Look to see if the controller's green pump running symbol is illuminated. Listen for any alarms present. Listen for a hum over the patient's left chest area, and ensure the connections are inserted and secure. If the LVAD is still not functioning and a spare system controller is present, the responder can consider a controller exchange. However, if the LVAD has stopped functioning for more than 10 minutes or the time is unknown, do not attempt to exchange the controller. If the controller exchange is performed and the LVAD is still not functioning after the exchange, chest compressions should be started. Starting chest compressions, irrespective of whether a pump is functioning properly or not, could dislodge the cannulas, resulting in hemorrhage. As part of the troubleshooting process, ensure the power source is connected and the drive line is connected. ACLS medications can be administered per protocol. Every patient with an LVAD should have a 24-hour emergency phone number that can be called. This may be found on a wristband or the travel bag that is with the patient. If you encounter a patient who is experiencing a medical emergency, it is critical you contact this number. When transporting the patient to the hospital, it is important to be mindful of the system controller, cables, and batteries. Ensure you are not bending, kinking, or pulling on the driveline, and be careful to not drop the system controller. You should also ensure the patient's black travel bag accompanies them to the hospital. In emergency situations where an LVAD patient's pump has stopped, within 10 minutes of stopping, get the pump restarted. Check battery charge and exchange if depleted. Check all connections to the system controller are fully inserted and the safety lock is enabled. Carefully consider the consequences of whether to start chest compressions. Administer ACLS medications per protocol. Call the 24-hour emergency phone number.